Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're talking about spondylolisthesis. That is a big word. But this came up. You went and spoke to a support group on chronic pain.
Right.
And they had some questions. One of the women's husband had spondylolisthesis, and how we can help at the Prather Practice for that. And we had realized we had never done a show on this.
Yeah, in all 16 years, it would be good to do a show on that, because we treat that quite a bit.
Yeah, it's probably because I was afraid I couldn't pronounce it.
Oh, let's do a different one.
One I can pronounce. But Dr. Prather, what is spondylolisthesis?
Well, it's a slippage of a vertebrae, usually L5, though it can be other vertebrae all the way up and down the spine. We've certainly had it even in the cervical spine. But it's usually the fifth vertebrae where it slips forward. Usually it's a slippage forward, not backwards. You have anterior spondylolisthesis, and then you have retrospondylolisthesis. And the most common one is anteriorly. So it's a slippage of the vertebrae forward. So it does cause quite a few problems. We have a lot of people who have come in for that particular problem because it's hard to find help along those lines. So it's a much higher percentage of our practice than in the general population.
Interesting. So that vertebrae slips forward.
Most, yes.
Okay. There's nothing with a fracture or anything like that?
Oh, yes. There are several reasons on spondylolisthesis on why that occurs. It can be a fracture, usually of something called the pars interarticularis. I won't make you say that.
But I think I know that where the pars are
isthmus.
On the side. Okay.
Yeah, it's an isthmus. So I show people, I have a spine and can show them where the fracture is. Matter of fact, I made a little line through it. And you could see where that would be an easy place to fracture. So oftentimes there can be a fracture there, or even an elongation. So it's not fractured, but the body's kind of has allowed it to be stretched out, the bone itself. So yeah, and that usually starts when you're younger. So usually if you look at children up until the age of 5, no one has a spondylolisthesis. It's usually starting at the age of 5. Most commonly, the problems start between the ages of 11 and 16. That's where the majority of the spondylolistheses develop.
And why is that?
That's a time of growth. Also, you have a lot more activity going on, so sports can be a big cause of that. So there are certain types of sports that are just well known to lead to a spondylolisthesis. And also there's the bone structure as you get older becomes a lot more harder. So it's much more difficult to fracture. They're still in their growth phases. There is growth going on, and so there's more stresses on that. It's not quite as strong as it should be. So it's easy to either stretch out the pars interarticularis or to actually fracture it at that point.
Do most people know if they fractured it? Is there always pain with it, or
there isn't always. There's not always an awareness. One of the things is, we had an example is our son Jonathan had a fracture of the spondylolisthesis of the pars interarticularis L5. And he was jumping on the trampoline, if you remember this.
I do.
And his sister wasn't. There wasn't supposed to be
his sister?
Well, it's both of their fault. They weren't supposed to be on the trampoline at the same time. And what he did was he had a big ball that he had put on there. that was about, what would you say, 2 feet in diameter? Mm-hmm. Yeah. And he was jumping over it. So he would bounce, jump over it, and did that little thing. And his sister got on there, and she started jumping up because it looked like a lot of fun. She was younger. And he was 11,
I think
believe.
A little older.
12?
Yeah.
Okay. He was playing football at the time. And anyway, he was going to land on his sister, which wasn't going to work because he was about twice her size.
Yes.
And so he readjusted and landed right on the ball and then hyperextended his back. Mm-hmm. And he said later that he heard kind of a crack and he was real sore, and he came in and said, I don't think he actually even told him exactly what it was. I don't think he told you, did he?
No.
What had happened?
And he said right away.
He said his back hurts. Mm-hmm. And so you told him, just put some ice on it, go lay down. Mm-hmm. And
are you blaming this one on me?
No, I'm telling you what happened. Am I wrong? Well, I mean, that's a normal response.
Right.
Kids
My memory's not as good as yours.
Yeah, kids get back pain, and
right.
they don't really communicate that well. Uh-huh. And we don't really take children that serious with back pain. Mm-hmm. Do you know what I mean?
We should.
So there's a point to all this.
Yeah.
This story. There is a point to this story. Let's be out open and honest on how all that goes. And so he was playing football, and I noticed that as he was playing, he wasn't doing very well. And so we called him in, and we took him we did X-rays on him, and I saw the fracture and the forward slippage. Mm-hmm. So we also got an orthopedic surgeon who was a specialist in that, took a look at it, said, yeah, he's got a spondylolisthesis. We got him a back brace. Mm-hmm. And we did some special types of treatments on him, acupuncture, adjustments, electrical therapy, some nutritional type of work. And we were able to catch it early, and we healed it, which the specialist didn't know you could actually do that.
Mm-hmm. So you can heal spondylolisthesis
if you catch it quickly,
right,
and you know what to do. But according to the normal type of thought pattern, any type of textbook, they say there's nothing you can do about it. Mm-hmm. But it was confirmed, and he doesn't have spondylolisthesis now. He's an adult and has a very good back, but we did catch that early. But that kind of shows you some of the things that can occur. He had a traumatic spondylolisthesis, but it can be something that can be gradual. Back pain a little bit. I've talked to a lot of people. They said they had noticed that they had back pain as they were younger, but nothing was done about it. Nothing was checked. So that's a very common type of thing, and that's why children should be checked for back problems.
Right, take them seriously.
Yeah, and it's just like dental work. Mm-hmm. You don't wait until your kid's teeth are like, I'm in pain.
Yeah.
You get them checked.
Right.
It's the same
Twice
thing.
A year.
Right. Same thing with a spine. You should have that checked at least twice a year. Mm-hmm. And as they're growing up, there should be some care as they're going along to make sure that they don't develop back problems later on in life.
Yeah, they do those scoliosis checks at school.
Scoliosis, right. Yes, but it's not really that thorough. There needs to be someone who's a professional who looks at it, really sees what's going on, makes sure that everything's going well for a child.
Do you know anybody that's a professional on the spine?
Yes, we do, which we'll be talking about.
So what causes spondylolisthesis?
Well, there can be several different things that are involved with that. There does seem to be a genetic weakness for certain people. Mm-hmm. One of the things that we find is a hyperlordotic curve is one of the most common things that comes.
More of a curve.
Yeah, you've got a lumbar lordosis. In other words, there's too much of a roll, stomach sticking out, hips back, chest is back, and there's extra stress in that lumbar area. And that's one of the things that is a predisposing factor along those lines. Poor nutrition. One of the reasons that you have a weaker area in through that is you get low in vitamin D, calcium, magnesium, phosphorus. Low zinc also can be involved in that. High aluminum can kick off those types of fractures. So there's a structural type of a weakness. There's also a nutritional involvement along those lines, and then sports activities. If you're looking at gymnasts or cheerleaders, those are just like, you have to watch that on almost every single one of them, and it's a very high incidence along those lines. Football players, if you're looking at the NFL linemen, it's close to 40% of them have a spondylolisthesis of their L5 vertebrae, which is one of the main reasons that many of them have to retire, is because of the back pain that goes along with that. Basketball players, always looking up, putting extra stress, going back into a lordotic curve. Volleyball players, all those types of things so certain sports really make a big difference along those lines.
But it's not always sport trauma or...
It's not always sports trauma or trauma. It can be just everyday living. Eventually puts extra stress on that, and that could be positional, nutritional, a specific trauma. All those different types of things can contribute to it, along with genetics.
Okay, when we come back, more on spondylolisthesis. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What is auricular therapy, Dr. Prather?
Auricular therapy is where you're using the ear to make some changes throughout the body. Auricular therapy usually refers to electrical stimulation of the ear.
So what is a microsystem, and how is that involved with auricular therapy?
With a microsystem, you're talking about a portion of the body that is in a smaller area, but actually can represent the entire body. Foot reflexology is one that people are very aware of. In other words, there are different points on the feet that have a reflex throughout the entire system. And then there's also the ear. There is an image of an upside-down fetus. That concept was found by Dr. Norgay. Dr. Norgay, a Frenchman, in the 1950s is the one who brought auricular therapy into science. One of his main things was he helped to map the brain. He was a neurosurgeon.
Well, I'm looking at your ear right now, and I can see that. So the earlobe's the head?
Yes.
Yeah.
The spine goes right along the ridge. You deal with the brain down in the earlobe. You deal with the rest of the system. You've got the internal organs are inside the ear. And it's a perfect representation of the human body only in the fetal state. That makes it much easier, and that was something that had never been imaged or recognized by anybody else before Dr. Norgay. You can get a good picture of working with the auricular therapy by imagining an upside-down baby, and then you can pretty well get to the points just by looking at it that way. You can affect anything and everything in the body by working on the ear. You can change the functioning of organ systems by electrically stimulating the ear. You can change the amount of bile that's flowing out of the gallbladder. You can change the functions of the kidney. You can change the heart rate. You can change blood pressure. All of those different types of aspects can be affected by the ear, even though you sit there and say, well, how can that be possible? And understanding the brain, how can it's the brain and the body connection, because the brain tells everything else what to do,
right?
And the ear is what I would consider the control panel of the brain. It's like a keyboard, and then you have the brain as the computer.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, today we're talking about spondylolisthesis. And Dr. Prather, you talked about what it is, what are some of the causes. How common is spondylolisthesis?
According to the textbooks, it's between 5 and 7%, but I disagree with that.
You think it's a lot more?
Yeah, I think it's between 10 and 15%.
Yeah, it seems like working here at the Prather Practice.
Yeah, and I've had other people agree with me who are out there, but officially it's between 5 to 7%, which is still a very large percentage of the American population. But I think it's underreported because it's not checked that often.
Yeah. And can you only see it on X-ray?
Yeah, the only way that you can tell is doing an imaging. You can do an X-ray, CT, or MRI and see it on there.
Okay.
Though oftentimes when I've done X-rays, the MRIs, they missed it on there. So that's not that uncommon. And even on X-rays sometimes, if it's not really looked at and evaluated properly, it can be missed. So we see a lot of misdiagnosis on that. I've had people who came in and I was talking about the spondylolisthesis, and they had said that they had been to 4 or 5 different doctors for their back with evaluations and it hadn't been picked up. So it is something that can be missed if you're not looking for it.
Well, I like what we do. We have the X-ray. We send it out to Dr. Terry Yoakum, one of the best radiologist in the country.
Yes.
So he sends us back a report. If there's any concerns he has, he'll call the office. I think that is such a great asset to have.
Right, and we use an independent radiologist. One of the things that when you're in the hospital situation, oftentimes they are only given 2 minutes to look at a film or an image is sort of a hospital norm.
I didn't know that, yeah.
Yeah, and when you're dealing with an independent radiologist, he takes as much time as he needs. If he needs to really sit down and look at it, he's had X-rays that he's looked at, really evaluated for 45 minutes for me.
Yeah.
Now, most of the time he doesn't have to do that, but he has the option to do whatever he wants to do. So I like
in healthcare, really.
I like that. That the radiologist that we use can actually sit down and spend whatever time he feels is necessary to accomplish what he's looking at. Whereas oftentimes, if you're looking more at a corporate, there are time restrictions. So I have talked to radiologists who had been reading it in the hospital situation. They said, "Oh, I'm sorry, I missed that." And then they would complain to me about the rules and regulations that they have.
Right.
So it's I like independent type of practitioners myself.
Yes. All right. Let's talk about the symptoms. What symptoms occur with spondylolisthesis?
Well, the most common thing that you're looking at is back pain. But not everybody gets back pain. But if you do have that type of a shift, there is changes in gait. So I've had people come in and we had noticed that they didn't really have back pain, but they had weakness in the legs. So we do muscle testing. We do some of the other different types of checks. We watch them walk and said, there's something wrong with your low back. And he said, well, I get occasionally low back pain, but I don't think it's any big deal. And then we go in there and press on the point and they go, oh, okay, that really hurts. But they weren't really that aware of it. Right. But they did have some weakness, abnormal gait, and then we went ahead and did the examination, found a spondylolisthesis on there, made the corrections, and then they were saying, I can tell a difference. Yeah. Though that wasn't the main thing that they were looking at, we check out the body from top to bottom. And to make sure that we're looking at everything that could be affecting the function of the body. And, we talk about the nervous system as the controlling factor of the entire system. You've got the endocrine system with the hormones, and then you've got the nervous system. They tell the entire rest of the body what to do. And when you have a spondylolisthesis, you do have some changes in the neurological system. It will always occur. And when you're talking in the L5 area, that can be urinary, bladder, bowel. There can be a lot of symptoms or things that aren't working right that people aren't quite associating with their back.
Right.
So it is important to get the nervous system working as well as you possibly can. So making a correction on a spondylolisthesis is something very important.
Why is it usually L5?
That's where the greatest, if you're looking at the forces of the body, how much weight is on there, the majority of the highest pounds per pressure is right there at the L5. It really holds, and especially if you get into a lower doses, it doesn't add pressure to it, it multiplies pressure. So you can really get a tremendous amount of force on that, enough even where if it doesn't fracture and you've got the growth, it will elongate the bone. In other words, the bone kind of stretches out. And that's one of the problems that can occur because of the extra pressure on there. It's in an abnormal functional position, structural position, and it does change even the shape of the bone.
Interesting. So can it be harmful?
Yes, you can get, we've had people with bowel and bladder issues and digestive issues. I've had people with IBS or chronic bladder infections, and they saw a decrease of those once we made the correction on the spondylolisthesis. If it goes too far forward, it can actually impinge the spinal cord and be very, very dangerous. So it's something that you have different grades on that. 25% slippage is a grade 1, 25 to 50 is a grade 2, 50 to 75 is a grade 3, and then a grade 4 is 75 to 100. Then you have a grade 5 where the vertebrae is actually fallen off the sacrum.
Wow.
And those can, if you've got the nerves that go through there that control the bowel, bladder, the legs, you can get weakness in the legs, numbness in the legs. There can, besides the pain, so there can be some definite functional types of issues that can even become an emergency.
Right. And it's just thinking of that, the vertebrae, the spine, the nervous system going through those foramen,
Right.
It's a whole different mindset than just bones.
Right.
It's so much more than bones.
Because we're dealing with a neurological system which is very complex and is very necessary for how we function. It controls everything.
Okay. Well, how is spondylolisthesis normally treated?
Well, if you're looking at the medical route, there is, first off, they don't recommend surgery right away, only as a last resort. So you want to try everything else first. And normally, if you were going to your primary care physician, he would send you to an orthopod, who would then send you to a physical therapist, and you would do some strengthening. Also, there's when you're younger, they would use a brace big brace that you would put on to kind of stabilize that. Corrective exercises, anti-inflammatories, pain relief medication to try to control a lot of the symptoms and to strengthen up the area so it doesn't go further. But they don't really try to correct the position. The people who do that is chiropractic. So that's really where you can get some amazing relief. I had a physician assistant who worked in an orthopedic office. She was a specialist in orthopedics, and she had spondylolisthesis as a really bad back problem. Matter of fact, that's why she got into that, because she had been suffering with that for quite a while, and she specialized in exercises along those lines. And she had 3 patients who had come through who had spondylolisthesis who had come to me and gotten what she thought was results that she couldn't believe. So she said, "Now, just to let you know, I am not a fan of chiropractic," when she came in here.
Have you heard that before?
I've heard that before. But she said, "I can't deny, I had 3 patients who came through here who've done amazing, and I've got problems. Do you really think you can help me?" And I said, absolutely. I've never had a spondylolisthesis that I couldn't really get under control. So I'm batting 100%. I don't think I'll fail on you. So she was all for it, and so we did the first adjustment and had instantaneous relief. Now, it took a while to get it all stabilized because she was very active in what she did, and she was heavily into sports. She was a big athlete. But we saw her for about a year and really got it so it was stabilized. So we were seeing her, about every 3 months or so, and really got it stabilized and was just very impressed with what we were able to do.
Yeah. And we're going to talk more about that when we come back, the structure-function approach to spondylolisthesis. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I'm in my 50s now, and doctors become obsessively interested in your prostate as soon as you turn 50. And it's a round thing, kind of like a donut, and his job is to check that it hasn't become a bagel yet. Right. Send me to a proctologist, your actual bum guy, who's not interested in any other bit of your body. He's a bum guy. Can you imagine doing that every morning, getting up and going in? Anyway, but he's messing around in there. He's looking for the lost treasure of Sierra Madre.
Have you ever been curious about how acupuncture can benefit your health? The Prather Practice has received the Indy A-List Award for Best in Acupuncture for 2 years in a row, and we've been rated the top acupuncture provider by Google+. Dr. Robert Prather is a board-certified licensed acupuncturist. He's earned a reputation for combining effective acupuncture-based techniques with cutting-edge technology to help patients with many conditions. Acupuncture is documented and proven to help with many health issues, including pain, allergies, addiction control, anxiety, fatigue, vision problems, infertility, and so much more. We even have needle-free options for those who are a bit squeamish around needles. Call the Prather Practice to schedule your appointment and experience the benefits of acupuncture for yourself. 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Well, today we're talking about spondylolisthesis. I want to spell it for some people. Spondylolisthesis, Thesis.
Okay.
Big word. So let's talk about the structure function care. That's what we do at the Prather Practice. We're a structure function healthcare facility. How does structure function care help?
Well, with spondylolisthesis, you have to add. It's not a complete system on really taking care of that unless you're doing structure function care. So you can't really deal with this unless you're looking at both aspects of it and making sure that the person is up to par. So structure function care always should be a part of a spondylolisthesis care. Essential.
Right, makes sense. Well, let's talk about chiropractic care and how helpful that is. And I've seen you align the spine with someone with spondylolisthesis. You have to go about it a different way.
It is, because I've had a lot of people who've come in, and one of the things, like I was talking about the physician assistant, is that she had seen some real problems going to chiropractors before with spondylolisthesis. And one of the more common types of ways of adjusting the lower spine is sort of a side posture roll, where you're coming in on it on that type of manner. And most people think of a chiropractic adjustment coming in from there or coming from the back with a posterior to anterior thrust. And both of those are extremely contraindicated for spondylolisthesis. So, as I was going through taking my state board tests, one of the things that they would pass you or fail you on was they would ask you, how do you adjust a spondylolisthesis? If you put them on a side posture or laid them posterior to anterior, you failed. Because that is contraindicated for a spondylolisthesis. You have a specialized type of a chiropractic adjustment for spondylolisthesis where you have them usually on a drop table. You have them laying down on their back with their knees brought up, and with a specialized type of technique where you stabilize the sacrum and then drop some force from A to P to bring that structure back. A to P means anterior posterior, correct. From the front to the back, even make it a little simpler, to get that moved back into place. And as you do that and you make the proper adjustment, you can just hear people go, oh yeah, that felt really good. But if you're doing it the other way, you're going to increase the pain.
Well, it makes sense if that vertebrae is shifting anteriorly, right?
You can't take it from the back. Yeah.
Right, you coming in from the anterior to shift it back. To shift it forward. And it's something that you need to be aware, and I always educate my spondylolisthesis patients how that adjustment is supposed to take place. So if they go to another chiropractor and they do that in a different type of a manner, then they should let them know that's not the proper way of doing it. Okay. So what structural issues make spondylolisthesis worse? Well,
one of the things that you're looking at with that is basically an increased lordotic curve. So you should have a position where there's always a perfect position for the spine, and that's the way that we work within our office. There are two different philosophies within chiropractic: a mobilization philosophy and then an alignment philosophy, and we believe in the alignment. So we're very dependent upon X-rays to know how to do our adjustments. And what we're doing is we're seeing where things are out of position, where we want to put them, and the easiest, safest, gentlest way to put it back into its proper position. So when the lumbars have shifted forward and the sacrum and the pelvis has shifted backwards, that multiplies the amount of pressure on the vertebrae, specifically on the pars and on the anterior spondylolisthesis. So we need to bring the sacrum forward, we need to bring the lumbars back and into proper position, into the proper alignment, and then we get really, really great results.
It's funny, as you're talking, you're doing your adjustment. It's like Tai Chi.
I'm very kinesthetic. As a chiropractor, of course, that's a very natural type of thing. I'm very hands-on, and I talk with my hands.
You were Italian.
Yeah, I know.
I must have rubbed off.
Yeah, there you go.
All right, so we talked about the chiropractic care. How helpful is acupuncture with spondylolisthesis?
Well, you need to get the pain level down, and you also have to reduce the inflammation. One of the things on the examination, you can look, because I teach my nurse practitioners and MDs on how to observe a spondylolisthesis and how to pick that up just from the exam. And usually I can pick it up just as I'm looking at someone. So laying him down, and you can see some of the indentation along those lines. But you can go in there, and usually also there's an inflammation in there. So I've had sometimes 2-3 inches of swelling, and I sit there and I show either the spouse or the parent or whatever, and I say, you see that? That's swollen up. And they said, I've been looking at their back for all these years and I've never noticed that. I just saw it last night and I never noticed, but yeah, that's really swollen. And so we will stick acupuncture needles in there, and often you can actually see the swelling go down. So instead of taking non-steroidal anti-inflammatories, which is the usual medical way of doing it, which can damage the liver and kidneys and have side effects, you can put acupuncture needles in there with no side effects and get the inflammation down quicker, better, and so it's a much better way of doing it. So acupuncture
if you're a licensed acupuncturist.
If you're a licensed acupuncture, yeah, just don't go sticking needles in people. They have to actually be acupuncture needles, not just needles.
And you have to be licensed.
And so sticking those in there, you can really get the inflammation. So again, it's a way of less stress, strain on the body, and you can get much better results and really get some amazing. And you can also increase pain, decrease pain quite dramatically with the acupuncture needles. And it was absolutely essential for my son for the healing on that. The acupuncture was critical, otherwise we wouldn't have been able to get that bone healed up again.
Yeah. Now he's lifting how much weight?
No, ridiculous amount. Yeah. He's a big boy.
His back has been healed.
Yes.
So why is rehabilitative exercises so important?
Well, you have to have rehab. I insist that someone with spondylolisthesis always have rehabilitative exercises, specifically for that, to strengthen the core and to get the muscles that are weak, the muscles that are tight. I put the bones back into place, but the body has a memory that it's adapted over a period of time. Otherwise, it wouldn't be in that position. So you have to change that memory in the muscles to keep it there. And I don't want to keep adjusting it on a regular basis. I want to get it in place. I want to do the rehabilitative exercises, so then we can make the corrections into the low back, so that it's a stable. And it just really makes it work, and then I can go 6 months without seeing you, and you're doing fine, and you come in for a checkup, and we do a little adjusting, but not that much. But
so important to have both
exercises. Yes, chiropractic has to have rehabilitative exercises along with that. That's just something that I feel very strongly about.
And a person with spondylolisthesis needs to be careful not to be what we call prone on their stomach, right? To increase that curve and watch any type of extension exercise.
Yes, and training on how to. One of the things that you guys do over in the rehab is train them how not to injure your back, what exercises you can do, what exercises you shouldn't do, and what positions are good, how do you sit. All those types of things are very, very important to part of the care of your back, especially in that situation.
Yeah. Let's talk. You talked about nutrition playing a role in spondylolisthesis.
Yes.
How does nutrition play a role?
Most people have deficiencies in vitamin D right now, calcium, magnesium, phosphorus, zinc, all those types of things play a role. And if the bones are stronger, especially growing up, they don't fracture as easily. They heal quicker. They don't elongate as easily. So the nutrition can play a very, very big role on this. Mm-hmm. One of the things that was essential for our son to be able to heal his back is we started him on some very, very strong nutritional, especially for building up the skeletal structure. Mm-hmm. One of the ways that we find out what's going on in the skeletal structure and the tissues is we do a hair analysis or a nail analysis. Either one will show what's going on, and most people have deficiencies or other different types of things that can lead to problems. If you're high on aluminum in your tissues, it actually makes the bones weaker. So there's a lot involved in that. Copper-zinc ratio is very important. You go too high on copper, low on zinc, you're going to have problems along those lines.
Okay, when we come back, more on spondylolisthesis. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. So why should disease care and structure function care work with cancer patients together? Why is that important?
It's critically important because when you're talking about any type of a healthcare system, we have truly the best disease care in the entire world. Mm-hmm. But we are last in outcomes in the developed world. So,
last in outcomes.
Last in outcomes. In other words, the results. Even though we have the best disease care and we spend the most on our health care, we have the worst outcomes. In other words, we have the lowest length of life. We failed. Mm-hmm. And why is that? Because we don't have structure function care as a part of our health care model. The division on that is 20% of all care should be disease care and 80% should be structure function care. And what we are trying to do is to integrate the two so that they work together. So we realize the necessity of disease care and the amazing things that they can do. And then we are adding the structure function care into it. And if we do that, we will then go from the worst outcomes to the best outcomes. And we can do that. So, we're looking at this totally differently than a disease care, and you need both a disease care doctors and you need structure function care doctors. We encourage everyone to have a structure function care doctor who's looking out for you and taking care of all the things that are preventable and keeping your health up and keeping you healthy, and then you don't need the disease care. I mean, that's
not
the goal
waiting
for
till you have disease.
Not waiting until you have disease. And the stool kit is one of the things. I mean, we do blood tests, we do hair analysis, and so we have the things that we recommend on an annual basis, and all the normal types of tests too. The colonoscopy, all those types of things, breast exam, gynecological exam, all those types of things. All those screenings are important, but we also need to add in looking at things in a structure function way, and we can really improve our outcomes.
Yeah, and these need to be part of the regular screening.
We do.
Your blood test, your hair analysis, your stool kit.
Right, and the stool kit is, again, the thing that has helped me to even keep them from developing the polyps in the first place.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
Don't stop believing.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about spondylolisthesis. And Dr. Prather, does pregnancy play a role?
Yes, I've had. Well, interestingly enough, the first person to pick up on spondylolisthesis was a obstetrician. Because he was trying to find out why certain women were having difficulties with birth, and he said, "Well, there's a bonehead slips forward." So he had discovered that, and he wrote up a paper along those lines, how that was interfering. So if you have spondylolisthesis, one, it can make it more difficult to get pregnant because of the nerve interference. So we have had women who were having infertility problems with spondylolisthesis, made the correction on the spondylolisthesis, and guess what? They were able to get pregnant because, of course, you have the nerve flow, and those particular nerves are innervating the sexual organs. So there can be an issue along those lines. And then if you do have spondylolisthesis and when you get pregnant, there's a very big pull forward. You change your position and that slips forward, and that can be a real painful type of situation. So women with spondylolisthesis, it's much more of a problem, and many more back problems than normal. So I get a lot of pregnant women in wondering how to keep their back pain under control. So we've been able to, that's a very common thing that we adjust with that. It's a very effective means of adjusting how we do that.
And very gentle.
It's extremely gentle.
Non-force.
Very, very light. And women go, oh. I've had some who said, I wish I knew that you could do this my last pregnancy because I suffered through.
Yeah.
And then it also helps with the birth process. Many times if you have a spondylolisthesis and you're trying, and that's a matter of fact why this particular doctor made a note of it, is that many of the women were having difficulties with their birth because of the spondylolisthesis. So it really made a big difference on how long they were in labor, whether they needed to have a C-section, whether, in other words, how things were going. So if you, that would be, if you're planning on getting pregnant, making sure that your back is working correctly, because if it's not, then you're going to have a lot more problems. So I see a lot of pregnant women with spondylolisthesis and make the corrections, and they love me for it.
Can obesity be an issue in spondylolisthesis?
Absolutely. If you have a extra weight, especially in the middle, that can help to pull the vertebrae forward. So that's a major factor. One of the things that I've told many people, well, we need to also lose the gut, because that's a constant pull and constantly trying to pull that out. So one of the things is trying to lose the roll in the middle, and that does help out quite a bit. And the extra weight for obesity can certainly increase and be a factor on developing spondylolisthesis.
Well, and you talked about the core and strengthening the core.
Yes.
And that would be part of it also, with that hyperlordotic curve, so important. And people need to realize the whole core is like the shell around there. It's both the anterior and posterior. So let's talk about, how is spondylolisthesis diagnosed?
The best way is imaging. So there are, I tell people that they need to come in. We need to look at, especially on kids, see what's going on. I've had many children who were having problems. Matter of fact, I got quite a reputation with this one gymnastic group, because this one girl came in and she was struggling with some back pain and wasn't doing well, and we did some adjustments on her. She had a spondylolisthesis. And she went out there, and she was so much better that everybody on her team came in. I need the magic adjustment to up my scores by 2 points.
Well, and isn't it cheerleading one of the most traumatic sports? I mean, it has the most injuries. It
has the most injuries. Cheerleaders, gymnasts. If your kid's going to be playing football, If basketball also,
Yeah.
they need to be checked out. If they're into sports, they need to be checked, see how it's going on. They need to have their spine checked and make sure that they can keep going. Because eventually that can, if it's left untreated, stop them from their pursuits and also cause a lot of major problems throughout their life.
So when should evaluations be made for spondylolisthesis?
Well, actually, it's best to check children for their spinal alignment even from birth, and then especially do an evaluation about the age of 5 on up. 5 years old is when they start to change their whole positioning. They have sort of the toddler type of back at that point, so it's a little different. But every year you should have your child checked on their spinal health, make sure that everything's okay, any type of a treatment plan that needs to be done to keep those corrections up. But keeping your spine, where the nervous system goes through, is more important than having your teeth checked.
But the dentists have done a much better job than
they have done an amazing job on teaching people that, which I couldn't agree more.
Yeah.
But your spine and your nervous system is far more important and should be followed and made sure that that's taken care of properly.
So can spondylolisthesis be prevented?
Yes. If I see a nutritional weakness, getting that fixed. Also, if there is abnormal positioning, pelvic unleveling, increased lumbar lordosis, then getting those corrections along those lines can really help out. Proper exercises along with that. You can really keep that from ever occurring in your child if you are proactive.
Right. Important. So can spondylolisthesis be fixed?
It can. We have been able to take, if we can catch it early enough, within the first 60 days, usually we can do the types of treatments that are necessary to actually get those bones to join back together again. After that, no.
It's a little more difficult.
Once they've healed and you've got the end plate that the body's put it on there, it's impossible at that point. So you can't heal it where it's a joint, but if you can catch it early and when you first pick it up, yes, it certainly can be fixed.
Important. So that woman that was at the support group, her husband was elderly. What about the elderly and spondylolisthesis?
I have treated people with this at 95 years old. And again, it's he was had spondylolisthesis, osteoporosis, several different types of diseases going on, but it was a very gentle, easy type of a chiropractic. He goes, well, that's it. I was expecting to be racked and cracked, and I said, no, it's a gentle type of way, and he gets up and he says, well, I can definitely feel a difference. He had been a dancer when he was younger, hadn't danced in 15 years, and he started dancing again.
At 95?
At 95.
Wow.
And so
it's never too late.
It's never too late.
So what steps should be taken if someone has spondylolisthesis?
Well, you need to find someone who is a structure function doctor who's used to dealing with spondylolisthesis, knows what to do, knows how to do the proper adjustments, and make sure that one chiropractic needs to be involved. You need to keep the inflammation down through different types of means. And then you also have to have rehabilitative exercises to make sure that the muscle memory is also corrected. But you don't get the same results with just one or the other. In other words, chiropractic really doesn't work that great without the rehabilitative exercises. Rehabilitative exercises don't work great without the chiropractic. So that's why I've always insisted in my office that we have both going on. Otherwise, it's not really a complete treatment system.
All right. Well, very interesting as always. Thank you, Dr. Prather.
Thank you, Lisa.
The Prather Practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.